Okay, hi, good morning. My name's Katherine. I'm the PA student that will be with you today. Can I get you to confirm your name and age for me?
My name's Amber and I'm 32 years old.
You too. Well, it's nice to meet you, Amber. Is it okay if I call you Amber?
Mm-hmm.
Okay. Can you tell me a little bit about what brings you in today?
Well, I've just been feeling like really down, pretty much really sad. And I was divorced. I've been divorced for like 7 months now.
Okay.
And I'm finding it really hard to make it through the day.
Okay. And how you said you were divorced, how was that, the whole process for you guys? Was it amicable? Was there a lot of stress around it?
Oh, it was not amicable. I didn't see it coming. It just,
Okay.
one day he just threw me and my child out, and, I had to find work. I wasn't working before, so
Okay.
it's just been a lot.
Okay. Are you working currently?
Yeah, I work in a grocery store.
Okay. How has that been during all the COVID mess that we have going on?
It's been really stressful, and I mean, there's just some days like I'm not doing very good at my job. There's just some days it's just the sadness is so overwhelming. I can't even get up from bed, so I'm calling out a lot.
Okay.
It's just been really hard.
Okay. And would you say all these feelings of sadness began at the same time as the divorce, or was it a little bit before?
Probably like a little, not as much, not like to the same extent. He was abusive.
Okay.
So there's just more like fearfulness, but I stayed for my child.
Mm-hmm.
And now it's just more so just like the reality of everything. It's just hard to kind of come to terms with.
Cope with. When you say that he was abusive, would you mind sharing a little bit more about that? In what way?
He was verbally and sexually abusive.
Okay.
Yeah, but never in front of our child. It was always,
And do you have a daughter or a son?
A daughter. She's 4 years old.
She's 4.
Mm-hmm.
And what kind of things do you guys like to do together?
Well, before, like, she likes to dance. We have like dance parties in the living room. She likes to paint and draw right now, so I'm trying to get into that. But it's just, I'm definitely not myself these days, and I'm having my mom come and watch her a lot more. So it's just, and that makes me more sad that I'm not there for her right now, because things are so different for her too.
Mm-hmm.
But I just can't be there for her.
Okay. You said your mom is helping a lot. Does she live close by to you? Is she able to come?
Yeah, my parents
easily?
both, yeah.
Okay. Well, that's good. At least you have that support system.
Mm-hmm.
Do you have any siblings?
No, I'm an only child.
And what about any friends that you've been able to lean on and talk to when you need to?
Well, a lot of my friends were mutual friends with my ex and myself, and they kind of seem to take more his side than mine, so I haven't heard from them since the divorce.
Okay. Would you explain to me a little bit, like, if you've noticed any changes in your sleep habits or your sleep patterns?
Yeah, I can't sleep at all.
Okay.
Mm-mm.
Like, you can't fall asleep, or if you do, you wake up a lot, or is it both?
It's kind of like a mix of both. I can't really fall asleep unless I like take something to help me sleep, like a melatonin. But even then, like throughout the night, it's just constant like racing thoughts, and I just can't keep my mind quiet.
Okay. And I know you said that's kind of playing havoc on your current job because you wake up and you're very tired.
Mm-hmm.
Okay. Have you noticed any changes in your appetite? You're eating more, eating less?
I haven't had much of a desire to eat. Yeah.
Okay. And have you noticed because of that you've lost some weight?
Like a little bit, but nothing like too dramatic.
Okay.
Yeah.
Okay. And energy levels, would you say that those have like drastically decreased as well?
Oh yeah, and I just feel irritable. I find myself just like lashing out on everybody, and that's kind of why I don't have my daughter with me right now. It's because, you know, I feel like I might take it out on her or someone near me, and it's just, yeah.
So is she with your parents right now?
Mm-hmm.
Okay. And does she have contact with her father at all?
Nope, we haven't heard from him since. So.
Okay. And I know you said you've been having some racing thoughts. What kind of thoughts are you having? About anything in particular?
I think it's just like fear is like the main one, and like a sense of like abandonment, like I guess being scared about that, being scared to be alone, and just like, yeah, a bunch of different like hopelessness, and just, I guess the thought of the future is really scary too.
Okay, like looking forward to something.
Yeah.
Okay. Have you noticed any behaviors that are out of ordinary for you? Like maybe you're spending more money or engaging in any kind of risky behaviors or something like that?
I would just say my like lashing out. Like I tend to just kind of explode and on anybody, and I don't really mean anything by it. It's just more like what's going on with me, and I feel really bad after, but
okay.
It's kind of just like impulsive, like I can't control it.
And when you say you're lashing out, is it more in like a verbal sense, like yelling, or does it ever become physical?
It got physical with my mom one time. Like I threw something at her just because she was trying to do so much and trying to help me, but like it was too invasive, and so I just threw whatever I had near me at her. And a lot of the times it's just verbal, like yelling at people or just being really short with people.
Okay. This is kind of a difficult question, but just so you know, it's a safe space. I just want to ask, have you ever had any thoughts about harming yourself or ending your life at all?
There have been those thoughts.
Okay.
Ever since everything happened, especially more so now, which is why I'm here.
Okay. And when did those thoughts begin? At the same time, you think, or more recently?
More recently.
Okay. And what exactly do you think about when you have those thoughts?
More just like how things would be easier if I just wasn't around.
Okay.
But nothing like more specific than that.
Okay. And have you attempted in any way to harm yourself
No.
or end your life? Okay. Do you ever feel like you maybe hear or see things that others around you don't hear or see? No? Okay. And besides the recent divorce, any other life stressors that have come up in the last few months, in the last year that you can think of as well?
Just like finances, like having to take over everything on my own, and it's really hard.
Raising your daughter on your own.
Yeah.
It's not easy, but I commend you for sure. And I know you said it's definitely affecting your daily life with work. Do you notice it affecting any kind of other functionings in your life, like all the sadness and the hopelessness?
It's like affecting everything. I just feel like I'm struggling and like dragging myself like to do one thing to the next, and you know, it's affecting my relationships with my family, and yeah, it's everything.
Okay. And so do you find too, like you don't find enjoyment in things that you used to?
Okay. Yeah.
Do you currently, or have you ever used any recreational drugs such as marijuana as an example?
No.
Okay. And what about alcohol? Do you use any alcohol?
Yeah, I've definitely been drinking a lot more since the divorce.
About how often would you say?
So I'm trying to think. I think I probably have like 4 glasses of wine, maybe like 4 times or more a week.
Okay. And would that be like 4 glasses in a day or total? Okay. And what previously would you have said your usual drinking habits were?
Probably like 2 glasses a week.
Okay. And is it usually only wine?
Yeah.
Okay. I'm going to ask you some more questions just about your history.
Mhm.
Okay. Have you ever been hospitalized for anything, any kind of medical issue or psychiatric illness?
No.
No?
Oh, well, I had a C-section with my
C-section?
Yeah, but
Okay.
that's it.
And that went all well?
Mhm.
Have you ever had any like outpatient therapy ever or counseling?
No, this is the first time.
And have you ever had any kind of symptoms similar to this in the past?
Mm-mm.
No. Any other symptoms such as like anxiety that you may have had when you were younger?
I was bullied a lot in middle school, and I didn't really want to go to school
Okay.
a lot during that time. Maybe there's some sadness there, but nothing like this.
Okay. So definitely different.
Yeah.
On a scale of 1 to 10, what would you rate your sadness?
Oh, it's like a 10.
10 out of 10. And besides the C-section, no other surgeries?
Mm-mm.
And no history of a seizure disorder with you at all?
Mm-mm.
Okay. And you've never had any kind of head injury?
No, not that I know.
And do you have any other medical illnesses we should be aware of? Any like high blood pressure, diabetes?
I have PCOS, but
Okay.
that's it.
Are you currently taking any medication for that?
I'm on spironolactone and birth control.
Do you take any over-the-counter medications at all?
I take like multivitamins and fish oils.
Mhm.
That's it.
And then just the melatonin that you've been trying to
Oh,
use for sleep
yeah.
currently? Okay. Any other herbal supplements you can think of?
Mm-mm.
Okay. And do you have any drug allergies you're aware of?
Sulfa drugs.
Okay. What happens when you take that?
I have a rash.
Okay. I want to ask a little bit about family.
Mm-hmm.
So are you aware of any psychiatric conditions in either your parents or any other family members?
We don't really talk about that stuff.
Okay.
So.
Are you aware of any alcohol abuse?
Mm-mm.
And what about any drug abuse?
No.
Were you ever exposed to, besides your relationship with your ex-husband, growing up, any kind of violence in the home?
Mm-mm.
And did anyone close to you ever commit suicide?
I have an uncle that committed suicide.
Okay. How old were you when that happened?
I was like 4.
4.
Mm-hmm.
Just to get a little better picture of you as a person, do you mind sharing with me where you were born, grew up?
I was born in Moreno Valley.
Okay.
Pretty much grew up in Orange County my whole life.
Mm-hmm.
Yeah. I went to school normally. I was bullied a lot in like middle school and high school.
Mm-hmm.
But I didn't go to to college or anything. I just graduated high school, got married shortly after, and yeah.
Did you meet your ex in school?
In high school, yeah.
Cool. And in your childhood, would you say you had a good relationship with your parents, or how would you describe that?
I was pretty rebellious during my teen years, so it was kind of rough with them.
Mm-hmm.
But later on, the relationship got better.
Okay. That's good. So you guys are closer now, would you say?
Yeah.
Okay. And then currently, I know you said your daughter is with your parents. So are you just living on your own?
Mm-hmm.
Is it around here in town?
Oh yeah, it's close.
Okay. Where do you guys live, in like an apartment or a little house?
It's a studio.
A studio.
Mm-hmm.
And I know you're currently employed at the grocery store. About how many hours a week would you say you're working?
I should be doing like 40, but Yeah, I'm not.
Just so hard.
Yeah.
Okay. How has that been at work? Is it going okay on the days that you are there?
I just get overwhelmed, like seeing all the people and just like all that like activity and stimulus. It gets to be so much sometimes, and I'm just so drained at the end of the day.
Okay. And have you ever, growing up, had any issues with the law?
Mm-mm.
Okay. So I know you shared with me a little bit about your drinking. You like to drink some wine. I'm going to just ask you a few more questions about your alcohol use, okay? So do you ever feel at any time that you like need to cut down on your drinking? Do you ever have any thoughts like that?
I definitely know I need to, but
Mhm.
right now it's kind of the only thing that I guess shuts everything down.
Okay. So it kind of brings you comfort right
Yeah.
now. Okay. Have you ever found that anyone in your family or in your social circle, like they get annoyed with you drinking?
My mom's told me that she's worried about me and
Mhm.
she wants me to stop. And like mainly because she like helps me so much with the baby, but like I can't.
Mhm. How does it make you feel when she expresses that to you? Do you get annoyed hearing that, or?
No, I get where she's coming from, but also it's kind of like I feel guilty because she's helping me out so much, but like I said, I can't really help myself right now. It's the only thing that works.
Okay. And do you ever feel any guilt from the drinking?
Yeah.
And in the mornings when you wake up, do you find yourself reaching for a glass of wine to help you get through your day, or are you able to kind of wake up and get yourself going?
Yeah, I mean, when I do go into work, I definitely try to drink something just to keep me level.
Okay. Do you feel like it helps take the edge off? Does it kind of give you that feeling?
Yeah.
Okay. And no issues with the law, so you've never had any history of a DUI or anything like that?
Mm-mm.
So I'm going to ask you some questions that go just into your overall health just a little bit. These are going to be kind of like yes or no questions, okay?
Okay.
So you said you've noticed a little bit of weight loss, but nothing dramatic, right?
Mm-hmm.
Okay. So do you ever have any fevers or chills?
No.
Okay. Have you noticed, besides currently, any other fatigue?
Mm-mm.
No. Any issues with vision, like blurry vision?
No.
No. Eye pain?
Mm-mm.
Have you noticed any ear pain?
Mm-mm.
No. Do you ever feel like there's a ringing in your ears?
No.
Any nasal discharge?
Mm-mm.
History of bloody noses?
Mm-mm.
Okay. Any history of sore throats?
No.
Difficulty swallowing?
Mm-mm.
Okay. Any history of heart palpitations, like you feel like your heart's racing?
Sometimes, yeah. When I'm at
Sometimes?
work, yeah.
Okay. Would you say that's every time you're at work, or is it when you're in certain situations?
When I'm just around a lot of people.
Does anything seem to make that feel better for you?
No.
No. Okay.
Mm-mm.
You just kind of
It just
stick through it.
Yeah, it just kind of goes away on its own.
Okay. How long would you say it usually lasts?
Not very long, maybe like at most 3-4 minutes.
Okay. Do you ever experience any kind of chest pain?
No.
What about any difficulty catching your breath or like shortness of breath?
A little bit of that with
Like the,
Mhm.
any pain when you take a deep breath in that you've noticed?
Mm-mm.
Okay, and any history of cough?
Mm-mm.
Okay. Have you noticed any stomach pain?
No.
No. Any issues with nausea or vomiting?
Not vomiting, but like nausea. Just yeah.
Okay. And what about diarrhea,
No.
constipation?
A little bit of constipation. Yeah.
So nausea and constipation. Have you been eating anything differently, you think, or
Mm-mm.
no? And would you say it started around the same time?
Yeah.
with your other symptoms? Okay. Do you ever have any pain when you urinate?
No.
And any history of UTI and infection?
Mm-mm.
Any muscle pain?
Yeah. Like I feel like super heavy and like
Okay.
just like I'm dragging myself. So kind of like
Okay.
after I work out.
Would you say that's all over or a specific
Yeah.
area?
It's just everywhere.
What about any joint pain?
Not really joint pain, no.
Do you have any history of headaches
Yeah. I've been having a lot of headaches lately too.
recently?
Mm-hmm.
Would you say that started before the divorce and your symptoms or around the same time?
More recently.
More recently. Okay. And how would you describe those headaches?
Just like throbbing and really overwhelming.
Okay.
Just like a lot of pressure.
Okay. Like whole head or one side? Okay.
Whole head.
Do you ever feel dizzy?
No.
No. Have you noticed any new rashes on your skin?
Mm-mm.
No? Okay. And have you noticed any swelling in your limbs and your hands?
No.
Excessive swelling? Okay.
Mm-mm.
Okay. So, I think with my patient's past history and symptoms, definitely top of my differential is major depressive disorder. I do also, of course, with her recent increase in drinking and the answers to the cage questions, I would not rule out substance abuse, specifically alcohol abuse disorder, and especially with her anxiety at work too. I'd want to ask further questioning about maybe some panic disorder or at least panic attacks that she's been experiencing at work. So those are my 3 differentials.